The Institute for Biohealth Innovation at George Mason University brings together more than 200 faculty and thousands of students who are working with partners around the world. Together, they are pushing boundaries. They're developing innovative technologies to advance science and healthcare. They're finding new ways to diagnose disease and inform the most effective treatment. They're working in the community to combat health risks associated with substance use disorder, obesity, and concussion. They're working on research with global impact.
The university created the Institute for Biohealth Innovation to harness the collective talent of our faculty and students, bringing them together to take on some of the big challenges in biohealth that we face today, as well as anticipating some of the challenges that we'll face in the future. So our students sort of reflect the collaborative, creative, high-tech biohealth workforce of the future.
Collaborations are essential to research because collaborations bring together people from different domains, cultures, people with different ideas. And the creative process is stimulated when these people come together and they compare their ideas, they contrast them. Some call it the collision of ideas. And this stimulates new and innovative solutions to the problems that we face.
Everybody's cancer tumor is different, and everybody's tumor is made up of many, many interacting cells. We wanted to have the concept of personalized therapy, but we realized that the technology at that time provided limits for us to be able to analyze the patient's tumor and make an individual therapeutic decision. So we developed laser capture microdissection to pluck out the tumor cells. Then we developed another technology called reverse protein arrays to map the circuitry of the cancer cell. And then we put that together in new ways to be able to predict what's the best therapy for that patient.
Infectious disease research that we focus on, which is specifically designed to develop new diagnostics, therapeutics, vaccines for either existing infectious agents for which we don't have ways to treat them, or things that might show up in the horizon and we really don't know much about the bug in the first place before we can even try to develop something to address the issue, and generally be prepared for anything that might show up in the horizon unexpectedly.
The gate analysis lab that we're in right now, which is a really great facility with fantastic equipment, and my colleagues and myself work to conduct research on the population from age 5 to 105. Through the tools that we have in this facility, we can help individuals perform better throughout the lifespan.
This will be the first time we'll really establish what a normal baseline is. It's similar to when you go and you have a 120 over 80 BP is normal, right? Blood pressure is normal. We don't know what's normal for a dancer. So we are trying to set that baseline, which will then hopefully become the baseline norm across the country, which then saves clinician time because they know what's normal.
Our center is a highly interdisciplinary center. It brings together engineers, neuroscientists, psychologists, rehab medicine folks to work on a multidisciplinary approach to understand chronic disability and function, and try to develop techniques to help improve function in people with disability.
Substance use disorder is a national priority for many reasons. I mean, one, as drugs have become easier to access and cheaper, more and more people are able to get them and use them for a variety of reasons. There's also a very big stigma around using substances and getting help for substances. We here at George Mason not only want to help prevent substance use disorder, but we also want to help those who are already struggling with substance use disorder. And we really want to address that from both the healthcare providers, through research, as well as actually direct services.
Well, nutrition is very important because everyone can be affected by nutritional problems. Even people who view themselves as having a good diet and look perfectly normal may have micronutrient deficiencies or other inadequacies in the diet. The most common nutritional problem right now, it used to be undernutrition, it's now overnutrition, too many calories, obesity. Also important, though, in the developing world is undernutrition, starvation, which still does occur.
If you look at George Mason University, we are attracting faculty and students from all over the world, meaning then we have to address problems and issues that are relevant to our population. Secondly, as a university, we want to develop, and graduate global citizens. We want our graduates to engage in different parts of the world, with different communities. For them to be able to work there, then they have to be able to understand what the issues are, whether it is the culture, whether it is the health issues, what are the potential solutions that are relevant and that will be sustainable in those communities.
Will HIV soon be a problem of the past? Can we ease the strain of PTSD on affected military families? Is there a way to prevent cancer in the first place? And can we break the barriers to accessing quality health care for all? Addressing complex challenges like these is most effective when we work across disciplines, with others who share a passion, yet bring unique expertise. We can't possibly know what scientific breakthroughs are on the horizon, but we can get there faster by working together. We need all the pieces to see the full picture.